and welcome again to the Therapy Corner. Here on the Therapy Corner, what we try to do is enlighten and educate on psychological issues and psychotherapy and counseling and those sort of things, and try to dispel any myths that may be out there in regards to those things. Today, we have a very special guest. This is Dr. Ken Hutchinson, and he is a licensed clinical psychologist, recently retired from the VA, the Veterans Administration, but is in semi-retirement. He's still available for private practice. He mostly focuses his practice on other therapists, and his main thing that he loves to do is train in Gestalt therapy. So we're going to be focusing on Gestalt therapy today. We're going to talk about what it means, what it's all about, why therapists should be or could be trained in it, and the benefits to individuals in general. So, Dr. Ken Hutchinson, glad you could be here.
I appreciate the opportunity.
Thank you. Mm-hmm. So, first off, what is Gestalt therapy?
So, the funny thing is, you could ask 10 different Gestalt therapists the same question, and they would give you 10 different answers. Mm-hmm. Because Gestalt therapy is so much an integration of who we are into a process that we call therapy, that it's very individualized for each person conducting it. There are some principles that organize Gestalt therapy. One is the need for here and now, present-centered functioning, as opposed to focusing on things from the past. Another is recognizing that the therapies that preceded Gestalt therapy had certain theoretical orientations that Gestalt therapy was a reaction to: psychoanalysis, early behaviorism, those kinds of things. And Gestalt therapy recognizes that our emotional process guides and energizes our behavior, not our cognitions as much. And an example I often use when I'm training people, or if someone questions this concept about me, is if you had a thought of some traumatic event and there was no emotion attached to it, it would be meaningless. So it is emotions, and it is at the level of emotion that most of Gestalt therapy, the healing process, takes place.
Okay, I see. So you're sort of, I'm this is probably unfair, but if you were to put it against, for instance, cognitive behavioral therapy, where the emphasis is on our cognition and what we're thinking about, say, trauma, mm-hmm. You're saying, let's take a look at the emotions that are associated with that trauma.
Right.
Okay.
When we process the emotions related to a thought or a memory, the thought or a memory become
meaningless?
Not meaningless, but they don't impact us the same way.
Of course.
They're still there, perhaps. Maybe not. Maybe they go away. But they don't have the same impact on us in our behavior, in our habits, mm-hmm. in our current level of functioning.
Okay. That helps. Thank you.
Mm-hmm.
Okay. So I'm a therapist, and I decide I want some Gestalt training. Now, thankfully, my foundation is in existentialism, so we're not so far apart.
Right. Exactly.
Yeah. Mm-hmm. But how would you help guide me into maybe doing things a little differently, and what would be different?
So it's a difficult question to answer, since I don't know your style. I don't know how you differ, in a sense, from Gestalt therapy. The things I can say are we are our own tool, basically. It is our inner awareness of our own process and our awareness of the process of the person across from us that allows the therapy to move forward. And so we may focus on very small things, a hand gesture, a facial expression, a shift in posture, a change in breath that indicate something's going on that wasn't going on before. So there's subtle cues we're looking for that guide us towards what's unfolding. A well-known Italian psychiatrist who's a Gestalt therapist said something like, we follow the client's energy toward closure for them.
Oh, interesting.
And so we look at their behavior, their energy, and there's some unfinished, unresolved issue, and we follow that through the resistances and through the creative adjustments that people have made to survive, basically.
Gotcha.
Those creative adjustments create habits that we continue to use long after a behavior is useful. So we develop certain kinds of habits. We have an experience as a kid of being humiliated or shamed or something like that. And so we develop a pattern of reacting to our concern that other people may judge us, for example. And so we live that pattern out, perhaps long beyond when it's useful. And that's, another thing about Gestalt therapy is that's the core of what we call personality. Personality is not, in Gestalt therapy view, personality is not something set aside separate from our past experience. It's the adaptations, the creative adjustments that we've made that focus our behavioral patterns and have us functioning out of habit rather than out of creativity in a moment's time. So I'm carrying on there.
I like what you're saying, because what brings to mind is a couple of things as you were talking. One, I want to get back to in a minute, was about the therapist in the relationship to the client.
Yeah.
But the other was in terms of the client and the flow of the energy and the habits that are created, and how sometimes we may put on a facade that really just isn't who we are.
Exactly.
There's an inauthenticity about us. And so, but we continue the habit when it's really not useful anymore.
It's not it's not useful in the sense of whatever the original reason that we're doing it isn't the reason we're doing it anymore.
Right.
And it may be unnecessary, but we've lived that habit because it's a habit, because we're used to doing it that way.
I couldn't help but think of, there's this video that I show in my class, and it's Fritz Perls, working with his client, and she's smiling. Gloria, yes. And she's smiling, and he's saying, "Why are you smiling? That's not what you're talking about."
Right.
And so you've got this inappropriate habit that's going along with some feeling that isn't appropriate. It's not. It's incongruent.
Like, I don't want you to see my anxiety. I don't want you to see something's going on inside of me that I'm not really ready to address or don't want to address. And a good therapist, Gestalt or otherwise, is sensitive to a person's their capacity to take risks, their capacity to do what we call a safe emergency.
Oh.
So what we do, the process of Gestalt therapy, is setting up an opportunity to try something different than the habit, basically, in a safe process, which is the therapy, rather than in the world where it may or may not go as well. So we try to set up a safe opportunity to try a different set of emotional reactions, behaviors, approaches, whatever.
So try to put the person more in touch with their reality rather than the facade that they've been portraying, the habit they've been using.
that and put them in touch with their creativity, because when we're operating out of habit, we don't create. We're not in a creative place. We're operating mechanically.
Right.
And so we're not operating what I would think of as organically in the moment.
I saw a TED Talk. No, actually, I was listening to a TED Talk. I take it back. I was listening to a TED Talk, and he was talking about the creativity and how that's been taken away from us in our modern world because, oh my God, we shouldn't make a mistake.
Exactly.
So if we can't make mistakes, we can't be creative because we have to toe the line and do the right thing. Yeah.
Reminds me, I do trainings with other therapists, and part of the training is always a participant working on something in their life in the training group with me or with another Gestalt therapist. And the funny thing is, and this is true in every therapy that I do, I don't know where things are going to go. I never do. I suspect at times, and oftentimes when I suspect something's going to go a particular way, it goes a totally different way than what I expected. And it's that creative energy where it will create itself. We don't have to operate out of our old patterns and habits. And I think we find more joy, more richness in life, more energy by doing it that way.
Spontaneity.
Yeah, spontaneity.
Spontaneity, yeah.
It's a good word.
Yeah, just being you, being present, being there. Yeah, very nice. Now, from a therapist, I want to go back because I did mention that. From a therapist point of view, in terms of working with and training, during the time we were talking prior to the show, you mentioned something really important, countertransference. And this is where the therapist starts experiencing something in relationship to the client. So can you talk a little about that in terms of Gestalt therapy?
Sure. We're human beings. Therapists are human beings. We all have experiences in life. And sometimes when someone's sitting across from us, they have an experience in life that triggers something emotional for us. And that emotional process can disrupt my capacity to be present with them and what they're needing to deal with. In Gestalt therapy, very differently from psychoanalysis, countertransference is considered useful. It's considered to be, in appropriate ways anyway, part of the process of therapy, and for the therapist to talk about, when you're saying those things, I get really distracted because it triggers something from my past. And to take a minute and let the client know you're affected by their story. And I think they need to know that we're touched by the things that they bring into the room with us.
Yeah, I can't help but agree with you because I think they need to see us as a human being connecting with them on a very human level in helping them to deal with their very human problems.
When you watch the video of Gloria with Fritz Perls, the style of relationship in Gestalt therapy has changed significantly. Today, the people that write about the Gestalt therapy, the therapeutic relationship in Gestalt therapy, talk about Buber's I-thou relationship. And so there's this call for authenticity, for presence, and when we're not, if we're treating them or ourselves like we're an it rather than a them, a they, then we have to recognize that and call it out as for what it is, and try to go back to authenticity. And it's from that authentic place that the movement of creativity of the client's energy toward closure can take place.
Yeah, I can't help but enjoy this conversation because of the fact that we seem to have gotten away from treating people as people and being real with them and treating them like, I don't know, mechanical beings that need fixing.
Right.
And I'm so glad to hear this. Buber's I and Thou was required reading in my graduate program.
For existentialism, I would bet it was.
Yeah.
Yes.
So, but it's so refreshing to hear you talk about this stuff, because you begin to feel alone after a while. Like everybody's out there treating people as objects rather than people as human beings that you can relate to and say, I know exactly what you're talking about because I was there. Let me tell you about what happened to me.
Yeah. Yeah. And I think it's somewhat, maybe greatly, driven by managed care, the pressure people feel, therapists feel from insurance companies to conduct therapy in the quickest, most efficient manner. Gestalt therapy is very effective. It may not be the quickest. I think it's probably the most thorough, or as thorough as any, and probably more thorough than the cognitive behavioral approaches.
Well, isn't that what the word Gestalt means? It
Yes.
means the whole.
Wholeness. Right.
Yeah, yeah, and you're right. Again, this is why I'm enjoying talking to you, because you do approach the person not just as a person, but being part of an environment. You as a therapist, part of a relationship, and so you're really taking in the whole. It's not just, oh, you have an eye twitch, let's deal with that.
Right. There is no I without a thou.
Right.
In Gestalt therapy, the whole concept of self is what we call emergent, which means self is in context of the world, whatever is going on in the world. And the self that's emerging is responding to the context that it's in. There isn't a fixed self. We have fixed habits, but we don't have a fixed self. And so in that sense, it's much more Buddhist.
I was just going to bring that up.
Yeah, the Gestalt concept of self is much more Buddhist than...
Yeah, it's fluid. It's not just an it that's
and
permanent.
it's contingent. It's within the context of the environment that the self is emerging in,
right,
so to speak. And therapy is an emergent process that way as well. It's a collateral or group, but collateral experience where two people are creating the experience together. It's not a therapist doing something to the client or patient. It's the collaborative effort of two people moving that energy toward closure, basically.
Talk to me a little bit about that, because you've mentioned the word closure a few times. In Gestalt therapy, what does that mean, or what is that process when you say closure?
Okay. I could do a whole hour-long lecture on this. So let's talk about where Gestalt therapy comes from.
Okay.
Gestalt psychology, which was Wertheimer, Kohler, and Kafka in Germany, were researching naturalistic learning processes.
Okay.
And sensory experiences. So you probably have seen the picture where part of it looks like a vase, and if you shift your perspective, it looks like two people looking at each other. That's what we call figure ground.
Right.
Okay. And so if you've ever seen a drawing where there's dashes that go around like this, our mind tends to try to create a meaningful whole out of something. So if we see these dashed lines that go like this, our mind makes it into a circle.
Right.
And that's what we call closure. There is a natural phenomena of our minds wanting to make meaning. And that's one of the ways that we do that. So people have experiences, trauma as a kid or whatever, and there's certain aspects of those experiences we're unable to process at the time, either because it's too frightening or because the world is not supporting processing it. or maybe a bunch of other reasons as well. So when that experience is over, it has a lingering impact on a person's adjustment to life. Mm-hmm. We learn to use whatever ways we coped, whatever creative coping skills we developed from that, and then we develop habits out of those coping skills. And so closure is about working back to whatever kind of unfinished, unresolved issue wasn't dealt with at the time of the experience, mm-hmm. and helping people in the present begin to process that so that they begin to have the emotions related to that. They begin to make different meaning out of the experience than what they originally assigned to it, so that their patterns can begin to shift.
I see what you're saying now. Okay. It's funny because you were mentioning the vase and the two faces. Mm-hmm. I was just showing that this morning in class. Mm-hmm. And we were talking about, the Gestalt and the closure and all. But I never thought of it quite that way before. That's really a beautiful thing, because you're basically saying, we're seeing the vase. Well, that may have been what we saw at the time of the trauma. But now as an adult, we can go back and say, no, let's bring some closure to it, to use your word, if I'm getting this right, no, there are two faces there.
It could be.
And for the individual.
Right. So the rigidity of the habits can begin to break down. If all you see is the face, you begin to be able to break down the rigidity of that, mm-hmm. so that you can shift between the vase and the faces, which is our natural perceptual process. It mm-hmm. just returns us to our natural capacities.
Okay. Getting away from that rigid, all I see is the vase, to the natural capacity taking in the whole.
Both. Right.
Right. Okay. Mm-hmm. Well, that gets back to the Gestalt, taking in the whole. Yeah. Mm-hmm. And, it's funny, I'd completely forgotten that the work that was done in Germany in terms of bringing in the senses and all that. That's a beautiful thing, because we've sort of gotten away from that, haven't we?
Oh, yeah. Current therapies, the evidence-based therapies, they may be really effective in some ways, but they have lost, in my opinion, lost some depth of therapy.
I a couple of times I've gotten into arguments with the insurance companies when they've asked for testing that I've done to show improvement, and I go, the client tells me they feel better, and they want this evidence-based stuff to prove that they did better. And I said, they did better, they terminated, they went on their way, happy campers. What more do you want? And this is the thing, when people come to therapy for me, and I say, there's no guarantee on how long this is going to take. During the 43 years, I've had 3 what I call one-session wonders, but I've also had people who come in with what seem like simple things that we're still talking 2 years later. Mm-hmm. Insurance companies hate that stuff, but it's reality for this person.
Yep.
This is the depth of their need, is to work all this through.
Exactly.
And we're missing that, I think, some mm-hmm. ways, and it's sad.
It is sad.
Ken, I know we talked about closure, but I want to just one more time come back to closure, because I think there's a misconception out there about closure in the way that you're talking about it. Oftentimes when we talk about closure, we're talking about just kind of finishing something off. Mm-hmm. But I'm hearing more than just finishing it off. There's a real process there. It's not just as, okay, you're done now, you can go on your way. It sounds like there's way more to it than the simplicity that I'm describing.
Okay, so let's talk about what's called the experience cycle, which is a Gestalt term for the different stages or phases of closure. Mm-hmm. Let's just use thirst as an example. So if I'm sitting quietly, I become aware. My awareness moves to some experience. So we'll just say thirst. So my awareness goes to thirst. I can ignore it, or I can take the next step, which is to assess options for dealing with that, to the point where we go through this cycle of experience where I take a drink of Gatorade, and that doesn't do the job. So the experience still hasn't created closure. So I take a drink of water, maybe that does the job. Something like that, where that need gets satisfied. So there it goes from quiet to sensory awareness to mobilizing energy to finding the options, trying the options. If the options are satisfying, we go to closure. Okay, does that make some sense?
Yeah, that helps a great deal.
And so closure is much more than the word that's bandied about kind of in layman's terms.
Right, yeah. It's interesting. I can't help but bring this up because it's something that I use in my therapy a lot. It's something Frederick Esperl's good old Fritz once said. He said, there are two great lies. I try to, and I want to. And I think of Nike nowadays with its swoop, and it's like, just do it, And, oh gosh, if we could just bring that into the therapeutic process and remember, wait a minute, don't tell me you try to. Don't tell me you want to. Do it.
Yeah. So that simplifies things maybe a little more than at least what current Gestalt therapy would do. There is a reason people aren't just doing it. There is some adaptive purpose for them that we need to figure out and explore to be able to help them to be able to do it. And so it's not just like cracking through the resistances or cracking through the defenses or what we call adjustments,
right,
or boundary disruptions. It's a matter of recognizing the functionality of the resistance, being able to use that awareness that somehow this serves a purpose for the person. There's no judgment about it. It's just this somehow serves a purpose for the person. We don't want to break through that. We want to help them make a different decision.
Okay. So if they're not doing it, even though they say I want to and I try to, there's a defensive a defense or a resistance there, and that's what we need to look at in terms of why aren't they doing it?
What is this serving? What purpose is not doing this serving for them? And it's serving some purpose. Maybe there's safety there. Maybe there's they just get too anxious if they try to move forward or whatever. They're probably protecting themselves from something. And maybe they need that protection.
Right.
We won't know until we're able to identify what the issues are.
And isn't that the joy of doing therapy, is exploring that with the individual, seeing what's that all about, and having them blossom, grow from it. That's a beautiful experience.
And then appreciating us as a participant.
Yeah, isn't it? Yeah. Finding that joy. Well, Ken, I want to thank you again for being on my show. I really appreciate you coming and sharing your thoughts and feelings.
Great. I'm sorry.
That's okay.
And it was an honor and joy to be here.
Thank you so much. Okay, so thank you again for watching the show. And again, at the end of the show, there will be contact information if you'd like to send in some feedback or if you'd like some ideas for future shows. So again, thank you and have a healthy time, both mentally and physically.